But you can see that you would just have this small portion for your connection. So if you have a primary infusion, what you need for the skill or the performance testing, you have to get all your own supplies. So for the primary, you're going to get your liter bag of normal saline. You're going to get the continuous flow tubing. You can see where these look the same, so you want to read it. This says secondary though, and this says continuous flow. And if you turn it around, this tubing is much longer than this tubing. Secondary is always shorter. You must have a flush, because you got to check the patency of your IV, alcohol, and the marker for the bag. So that's what you need if you have the primary IV. So you would just verbalize. I would do all my overriders. I've introduced myself, you knock, and then you're ready to go. So what you do first is you want to flush your IV, make sure it's patent, because if it doesn't work, none of this matters, because you're going to have to get an IV access. So get all the air out of your syringe, and you're going to clean this port with alcohol. You'd verbalize. I would clean for 10 seconds. So you're scrubbing. And then you're just going to connect. Notice how when I took the cap off this, I did not touch the tip of this. You have to keep it clean. All right. You want to make sure these clamps are open. And if you wanted to, you could draw back, but we're not going to see blood on this because it's not a real patient. And then you just push forward. And what are you looking for?
The flow.
The flow. And because we have tape here, you're not going to see it, but you will just verbalize. I will look for signs and symptoms of phlebitis or infiltration. Because if it's infiltrated, it will either leak on the sides or you'll see an immediate bubble. If it's phlebitis, you'll see that before you even do that because you'll see the red streak beforehand. So you flush through, and I leave that because I want to keep my connector clean. Now, you can take this off if you want. Just know that when you're ready to connect, you've got to clean with alcohol again. I just choose to leave it on there. All right, so then you have your saline bag. So this has a little perforation. You see a tiny slit. Just tear it out of the bag. All right, you hang it up on your pole. All right, so as far as the bags, this port here with the plastic, this is so that a person can inject medication in the bag using a needle and syringe. So you're not trying to pull this off. You pull this. Some of our bags have a clear plastic tab. That's what you pull. You're never trying to spike the medication port. So you're only going through there. You're spiking that. So you hang it on your pole. All right, and then you get your continuous flow solution set. There's a little perforation on the side. You open it up, tear off the white paper, and you just untangle it. All right, so I keep this part in my hand with the cap on. And what you want to do is once you pull this blue tab, you don't want to touch around there because you want to keep it clean. And then you're going to take this cap off of here. So you can just pull the blue tab hard. Yeah. All right, and then you're going to take the cap off that. You're not going to touch around there because you want to keep it clean to clean. You don't want to introduce germs into it. You can kind of see, can you see the ridge along there? That is how far you're going to go up and into the bag. All right, so you just grab it on the sides, go in, and you twist and push until you meet that ridge. You notice the fluid automatically comes through. So then all you do, take the cap off the bottom, let it flow till all the air comes out. You have 2 clamps. It's easiest to use the roll clamp. The roller up means it's open. You roll it down, it stops the fluid. Now all you do, bring it over here. Take this off because it's clean. Now I don't have to use alcohol. And you connect. You unclamp, and as part of the skill, you want to get 1 drop every 3 seconds. So you just count. 1001, 1002, 1003. That's it. So that's primary. All right. Any questions about that? If you're doing secondary, you need your secondary. Oh, I'm sorry. You need to measure or tape your bag. For the primary, this is a way to mark the bag so that looking at it, you know as a nurse how much fluid has gone in. And so it's for the input. You just tear off the little side, and then you can get to the other side. And the numbers should match up. Now, on our bags, it may match up, it may not. So I always start with like the 9 and work my way up. So you just go to 900 all the way up. So if you come on at 7, you're going at 50 drops per minute. You could either look at the pump, or you could just at the end of your shift make a little mark. Let's say on 600. So you know during your shift the patient got 600. And then when the other nurse comes on, let's say she leaves after 8 hours, it's down to 900. She knows within her time frame only 300 went in and not the full bag. So it's just an easy way to mark the bag. We used to just mark on the bag itself, and they realized from doing testing that the ink fluid actually went inside, or the ink actually went inside the fluid.
How did you know that it was 3 drips per second? Like,
so
like how did you yourself measure?
1 drop, 1001, 1002, 1003.
So the drop off.
Mm-hmm.
Okay.
So it's when the drop falls. It look like it's sped up stuff. But it's just a slow drop. And that's just so that if you don't have a pump, you're able to set a rate yourself based on how many drops per second. That's all it is. All right, so that's the primary. So you mark the bag and then you're done. For the secondary, you got a secondary infusion tubing, your medication. This is the label for the secondary. And then you need alcohol. You don't need a flush. So for this, you open up the tubing the same. You're going to keep the hook. I'll show you what this hook is for. You tear off the paper. What I immediately do after opening up for the secondary is I clamp the tubing. So the roller clamp up is open. You clamp it all the way down. What happens is the minute you spike this bag, just like that one, how it flowed, the fluid flowed out, this is an actual medication. You do not want to waste it. So you don't want it just spilling out like that. Now for the secondary medication on here, the gray says add, and the one with the clear tap says set. We're not adding medication. Add is to add medication. We are just going to spike the set. So you want to look at the wording. So you're just going to take the cap off where it says set. All right, so as far as doing this, you can hang it up and then spike it. It's up to you, but I like to just keep it in my hand. I take the cap off of this one. I take the cap off of this one. You don't touch anything else. Same thing. You spike until you get to that ridge. And then you spike, and it's twist and push. I'm clamped, so you're not going to have anything that flows. What you want to do is connect to the port that is closest to the IV infusion or the fluid. So that's where you need your alcohol. So you can hang this on the pole, get alcohol, and you're going to clean this 10 seconds. I would clean this for 10 seconds. Keep holding it in your hand. You're going to take the cap off the other side. And then you're going to push in and screw on. Now, the easiest way to prime this, because you've got air in this, the easiest way to do it, take it off the pole, unclamp this all the way, unclamp this. What's going to happen is it's lower, the fluid's going to go in here. You see how the fluid's dropping down in here? It's clearing out all the air in your line. So you've primed your secondary tubing. You hang it up. You're good to go. Then all you do, you just verbalize. I would add my label to the secondary medication that has the patient's name on it and what is inside the actual bag. And you can put the label anywhere. Doesn't matter. It could be on this side or this side. Doesn't matter. Now, in order for the secondary to flow in and not the primary, because when I open this, only the primary is flowing in. You want to give the secondary. So how you do that? You take this off the pole. You hook it onto here, and you lower it. Yep, unclamp this. This stops, that goes. So that is part of the skill for the secondary. You have to lower the primary. Then what happens is, as all the secondary goes in, this will automatically start instilling again, based on gravity and the pressure on this back valve. So when the majority of this goes in, you'll start to see this one drip. And it's just natural.
What was this thing called?
It's just a clamp or a hook. I mean, it comes in every packaging for the secondary, because you have to do that. Even if you're using a pump, you still must lower the primary. Otherwise, the pump will not pull it. It still needs help from gravity.
Do we need to set this to a certain amount?
No.
And we're gonna hop in the test either one?
Either one. So if you have the secondary, there will already be a primary line. So when you come in, you'll see a primary hanging up. And you've got to come and add it. You've got to lower the primary and hang your secondary.
When you lower the primary, you can get 3 seconds.
No, because when you're doing the secondary, you're not instilling the
I'm
primary.
saying, like, you close it and then it automatically starts.
No, you just have it wide open.
Oh, okay.
It stops because of that.
Oh,
If you want to control how fast the secondary goes in, then you have to use this clamp.
okay.
But you don't use that clamp. If you use this one, then you've stopped everything. So after this one goes in, you'll start to see that,
After
the
this one
primary.
goes in, that this one starts to go in, is it going to be already adjusted?
no, so then that's when you would have to come back and then readjust it, yeah.
And that's the rate that you want us to put it in?
There's no rate, it's just wide open. Yeah, you'll see, because this is about to be done. Yeah, the secondary, a lot of the secondary medications go on really fast. Now, if it's like Dilantin in a secondary, they may have it go over 4 hours. If it's Protonix, that can also be secondary, it may be like 2 hours. So it can go very slow, and that's where you would use a pump. But you'll start to see, as this finishes up, this is going to start to flow.
Oh, okay.
It's not going to do it. It did it yesterday.
Do you have a video of this? No?
Maybe you guys can post it.
It didn't go.
There you go.
Oh, there we go. You see the primaries going on.
But it's sped up instead of.
Yeah, because it's wide open. So as a nurse, if you weren't using a pump, you would just come back and just reset it. Yeah.
For the skills itself, do we have to come back and reset it, or you just want to see that we know how to hang it?
Yep.
And then, is this something that we have in our nursing pack? Or
Yeah, so we have the stuff for you guys to practice with. Next week, bring whatever IV supply is in your kit, bring it here. So replenish our supplies so that when you do the testing, we have supplies for you. All right, so any questions or anything? I'm going to leave this set up the way it is, and then you guys can practice.
Right.